Good evening, I'm Alexandra Riley and you're watching Six Docs. We've all seen the heart and stroke commercials that run on television. They tell us the symptoms to look for when having a stroke and what needs to be done in the event of having one. They save lives, but one common misconception surrounding a stroke is that it only affects those over 50 and with heart problems. But for Herbert Sax and his family, he learned that a stroke and its effects can impact just about anyone. Our field reporter Brendan Purdy has more on their story.
Herbert Aaron Sax, a 28-year-old native of Toronto, spent his life performing, whether acting, singing, or pursuing sports broadcasting. However, on February 15, 2017, his life took a devastating turn for the worse.
February 15th, 2017, I was about to go meet my friends to go for dinner and then go to see a movie. It was around just before 5 p.m. and I was getting ready and Herb was about to leave to go to night class at school. So I asked him if he could stick around a little bit longer, just like an extra 10 minutes so he could drive me. And he said, yeah, no problem. So he had just gotten out of the shower and I was getting ready and I was in the washroom and I remember looking in the mirror. I was doing my makeup and I could see him behind me in the mirror and the left side of his face was droopy.
I'm talking to her and she says, I guess my mouth was drooping and it was spitting out the sides of my mouth and slurring my words. And she said, talk to me real, like stop screwing around with me, like tell me what is happening right now. And I couldn't. And I was trying to put a shirt on, my arm was floppy, couldn't quite get it on. She had to help me with that. And at that moment she realized, she said, I think you're having a stroke. And when she said that, in my brain, I don't know, I think maybe I thought there's no way this is happening, but also like some weird stuff is going on right now. So we're in the bathroom when that happened. She takes me, she leads me out of the bathroom, down the like small little hallway in our condo, right turn me into the bedroom, puts me down on the bed. Now, the way I remember it, so maybe it's a little foggy, she went to call 911. Her phone was attached to a speaker, so I could hear the 911 call, and I guess that kind of freaked me out. So I felt like I tried to get up. She says she helped me up. I think I don't remember that, but in my memory, I got up, collapsed onto the ground.
He kept trying to get up, and he couldn't do it. I immediately called 911, told them what was going on. I heard them answer the phone, and I actually had my music playing. And it was connected to a speaker, so they were saying, hello 911, hello 911, and I was talking and they were answering me. So it was crazy and I had to run and unconnect the speaker. So I was telling them what was going on. I was saying, I think my boyfriend's having a stroke, and they said, how do you know? And I was identifying the symptoms. Again, a left droop, he couldn't move, and he was on the ground, and he kept trying to get up, and while he was getting up, he was hitting his head all over the drawers near our bed, and I had to really tell him to stop moving, because I didn't want it to get worse. And they told me to ask him a couple questions just to kind of clarify what was going on. And I remember one thing they said, they got me to ask him to say is, the early bird gets the worm, and he couldn't say it. And they said, we're going to be there as soon as we can.
I remember lying on the floor after the 911 call had been made. Before they come, I was lying on the ground thinking, this is how I go. This is it. I'm going to die. Which was kind of crazy, but at the same time, I kind of felt like calm. Like, this is happening. There's nothing I could do. This is happening. Let's hope that I get through it. But I thought it was the end. I was not going to like start freaking out. So they took me, the only part I don't really remember of it is being on the actual stretcher. They put me on the stretcher in the room, wheeled me down the hallway in the apartment, into the elevator, into the lobby, into the ambulance. Don't remember any of that. Don't remember being in the ambulance, but I have now learned that Maggie was in the ambulance with me. I was asking for her. I was talking to her. I was, while out of it and slurring and spitting everywhere, I was still like clearly aware of what was happening.
We got in the ambulance. We must have been in the ambulance for 5 minutes. It was super fast. Fortunately, we live really, really close to Toronto Western Hospital, which has a reputation.
When I get to the hospital, I remember coming out and seeing my brother who beat us to the hospital, Ryan. I remember him being there. I said to the ambulance driver, "How did we get here?" He said, "In the ambulance." And I said, "I didn't feel anything." He said, "I'm a good driver." I remember that encounter. So then I remember seeing my brother Steve as I was going in, who has been through this before. He's had strokes. And I remember him saying, "Don't worry, Air, you're going to get through this. It's uncomfortable right now, but you're going to get through this." And that, gave me a little bit of hope and maybe kind of made me think that this is going to be terrible for a while. For however long this procedure is going to take, it's going to be terrible, but I'm going to get through it. And I was just waiting the whole time for it to be over.
We were notified by Toronto Emergency Medical Services that they had a patient in the ambulance that was en route. We were told it was a young man who was having difficulty speaking, and he had serious left-sided weakness. So that meant that our stroke team would assemble in the emergency department waiting for him. Once he came in through the front door and he was at triage, we were told that his stroke started at 5 p.m. He arrived in the hospital 39 minutes later, and within 6 minutes, so by 5:45, he had already been assessed and was in the CT scanner. His stroke was considered severe. His NIH stroke score was 16, which is a pretty significant stroke, especially when it's affecting the right hemisphere. So within 6 minutes, we're getting our imaging, which I'm going to show you shortly. By 5:55, so 16 minutes after he walked in the door, he was getting the clot-busting agent, TPA. And then as soon as that was being infused, we notified our angio team, our interventional neuroradiology team, that we were bringing him up to the angio suite. And you can see that by 6:24, so within 45 minutes of arrival, he was on the table and the angiogram was proceeding because they'd already put the catheter in the groin. And we were able to open up this clot by 18:45. So the door to complete cure, in the sense we've opened up the blocked pipe, was 66 minutes, so just over an hour.
But while enjoying a vacation cruise on the Celebrity Equinox, Herbie's parents, Barb and Len, received a devastating call from their son, Steve.
He said to me, "Aaron, Herbie had a stroke. He's at Toronto Western," and he was talking, he was explaining to me what happened, and I heard everything he said, but when Len came out of the shower, I couldn't repeat anything. It was not a nice feeling to be far away and for it to be complicated to get home. But we got home. We did get home.
Coming up after the break, Dr. Frank Silver breaks down Herbie's procedure as we delve into Herbie's recovery process.
When he told me he couldn't sing, I know how much he loves to sing.
On what could have been a fatal February night for Herbie, Dr. Frank Silver walks us through the procedure that saved his life.
So thrombectomy is not that new, in the sense we've been doing it for several years, but it took us a while to perfect the technique. Initially, we were actually putting TPA right into the clot with a little tiny catheter and slowly infusing it. But the name of the game here is speed. So if you think about it, if you're putting Drano into a blocked pipe and you're waiting for the Drano to eventually open up the pipe, that's slow. Whereas if you put in a vacuum cleaner and in a few minutes suck out the clot, or if you use one of these so-called stent retrievers and open them on the clot, inside the clot, and pull it out quickly, we can open up an artery like in 15 minutes, whereas before we would often take an hour or two to open up that same artery. What I'm showing now is the CT scan that was done shortly after Herbie arrived in the emergency department. We're showing images that are the CT angiogram part, meaning that We've injected contrast or dye within the vessels, and we're seeing all the arteries within the brain lighting up. So immediately on this image, just to orient you, this is right and this is left, and he's actually looking up, so this is back of head and front of head. You can see on the left side the normal arterial tree where this middle cerebral artery branches, and we see lots of branches. If we then look on the right side, this middle cerebral artery comes up and then it abruptly ends here, and we obviously see that there's a part of the brain that's not getting much blood. If you see it now in the so-called coronal plane, which is now he's looking at us, this again is right, this is left. We see that this is the carotid artery coming up and it's blocked right here as compared to the other side where all the branches continue. So we knew that as the plain CT showed, there was a clot sitting out here, and that was responsible for his symptoms, the paralysis on the left side, the difficulty with speech, the facial droop on the left side. So we want to know what's viable, and the way we can tell it's viable is how much collateral there is. So we do that by a couple of techniques. If we look at the later images of the same picture, I'm going to go back up to this part of the brain. You can see that later on, this is literally 12 seconds between these two images. Notice that this artery now, which is this artery, which was completely blocked, you can actually see where the clot is because there's a gap between here and here. So that between that space, there's a clot blocking the artery, but eventually blood gets back to where that clot is, which is a good sign because it means that some blood is getting to the right side. This colored in area is the brain that is not receiving adequate blood flow. So this is what we call a perfusion defect. The images on the left are the areas that seem to be in jeopardy where the brain we think may not survive. But the point is that there is a mismatch between the amount of blood getting to the brain and the area of brain that may not survive, suggesting that we have a lot of brain tissue that can be salvaged. What we've done now is the interventional neuroradiologist has put a little tube or catheter in the groin and the femoral artery, and now we're seeing the contrast go up to the carotid artery in the brain, and we see that there's a paucity of vessels here. There's not too much filling. And if we look very closely and we zoom in here, we can see that there's a big branch here that just comes up to about here, and then it stops. It should be going up here and filling a whole bunch of branches more distally along its pathway. And in fact, if we look carefully, there's a clot. We can see kind of an outline of what we call a filling defect in the artery blocking the artery. If we now show with the before and after, so the next thing the radiologist did was to bring up a huge suction catheter, put it right here, and then turn on the vacuum, and was able to suck out that clot. So if we show you, this was the before, and then we'll show you the after. So here's the image, and you can see right away that now lots of the brain is being perfused. But if I zoom into that area that was blocked, so that's that artery that ended here, and now we can see it's continuing because there's no longer a clot there. And if I zoom back and look at how the blood is getting to the brain, you can see lots of branches, and this blush shows us the blood is getting everywhere, as compared to on this scan, you can really see that there's a big hole in the brain here that's not getting adequate blood flow. There were areas based on that perfusion scan that were perhaps not going to survive, and there were some patchy areas shown on this scan. It's called diffusion-weighted imaging. Those white areas or bright areas are areas where the cortex has been damaged. Now, fortunately, the brain has the ability to repair itself, and it doesn't fix the damaged areas, but what happens is the viable tissue reconnects to parts that have been damaged, and that's what we call neuroplasticity, and that explains why there's recovery over time.
The quick action of both Maggie and Dr. Silver's team at Toronto Western saved Herbie's life. However, his road to recovery would be a long and arduous one.
So I did 3 months at Toronto Rehab, which is an excellent facility. I did occupational therapy, speech therapy. I had social work. Aside from those 3, I also did facial nerve rehab, and I met with acupuncturist about acupuncture in the brain. Never ended up doing it. Scared me a little bit too much. I used, there's this Theraputty, they called it, which was like silly putty thing, which could help me regain strength in my hand. That was a big thing. Resistance bands also for strength in this arm and this leg.
He went through quite an extensive rehab, but he persevered really well and stuck with it, and Barb gave him support all the way. I was there too, but Barb continued on for a long time with him. Yeah.
I drove him crazy. He knows that's true. I drove him, did you do your exercise? Did you do your exercise? Every minute, did you do your exercise? How many times did you do your exercises? But they helped, and he got better, and that part really improved quickly.
Herbie's rehab also included a few unique practices of his own.
I played a lot of guitar. I'm not a great guitar player. I taught myself a couple years ago, but just the dexterity that you need to use in your fingers on your left hand to play guitar, it helped a lot actually playing guitar. The sad thing about playing guitar was I couldn't sing anymore. I fully lost my ability to sing, so at least I could still do something musical. But my whole life, I trained as a singer. I was a professional music theater performer, and I never really realized how much singing meant to me until it was taken away.
When he told me he couldn't sing, I know how much he loves to sing. I know he loves to sing.
And that was tough, really, really tough for me. And I remember the morning that I discovered I kind of could sing again, ish. I woke up, I tried to sing. I tried to sing every morning. Every morning I said, nope, nope, nope. And then I think maybe 4.5 months after, I finally had like a bit of what I used to have. I remember calling my mom and going, I can sing! And she was like, sing to me, sing to me!
He can sing now. He can sing. I'm not sure if he can sing as well as he could sing before, but he can sing. I think the saddest deficit was that he didn't have the same control over the left side of his mouth as over the right side of his mouth, and so he couldn't smile. And that was the hardest thing, because no matter what happens in your life, you can't go through life without being able to smile. Like, you got to be able to, you know, if you can't, you have to be able to smile.
Coming up, genetic counselor Josh Silver and I look into the Sax family history with strokes.
My father was 26, I was 27, my brother Steve was 28, and then again when he was 33, and my uncle was 29.
With 4 family members, including Herbie's dad, uncle, and brother, all suffering strokes in their late 20s as well, genetic counselor Josh Silver sees the Sax case as anything but ordinary.
It's unusual for sure. I've never seen anything like it. Usually, we tend to see a greater range of variability with genetic diseases in families. If we see a family like the Saxes, we're going to do every test that we can possibly think of because we know that it's hereditary. We don't need a genetic test to tell us that there is a hereditary cause of stroke in the family. How many tests we end up doing really depends on how long it takes us to get to a diagnosis. Sometimes we can make the diagnosis right on the first test, and sometimes, like the Saxes, we can be doing multiple rounds of testing and get no answer.
Everybody always thinks they're going to find an answer, but in almost 40 years, we haven't found one. So hopefully this time we find one. We can't be the only people in the whole world. There have to be other people who suffer from this too, right?
So the other possibility is that the whole exome sequencing finds a gene that's causing their strokes that's never been previously described in the medical literature, and this is a new discovery. And that absolutely will have an effect on other patients and families with similar conditions. I'm sure that in my career I will see other families who have strokes like the Saxes, and I will be able to hopefully go back and say, I had another family just like yours. We found a mutation in gene X. I think this is the same thing that's going on with you. And rather than having to look at every single gene for them, the way we are with the Saxes, we can look at just that one individual gene in this next family. And obviously, if we publish this as well, this could help families around the world as well. I'm sure the Saxes are not the only family with this specific genetic condition. We just haven't found another one yet.
So not only is this a big deal for my family, for my mother, for my nephews, for my brothers to know what is going on here, but if this gene is discovered, this could help people all over the world. We can't be the only family that is going through this. It's not possible that one family in the world has this genetic mutation that causes stroke. Someone else somewhere has to be going through this. And while it was tough and it was hell, at least there'll be some satisfaction that what we went through wasn't in vain, and we're able to help other people and change the world for the better.